Good evening. I would like to call this meeting of the Pitt County Board of Health to order. First item on our agenda tonight is for public comments. Are there any members of the public who are here who would like to make a comment? None appearing. We will move on to the minutes. You have before you the minutes from the last meeting, which was June 11th. Are there any corrections, additions, or changes to the minutes?
Second.
A move and a second to be approved. All in favor say aye.
Aye.
All opposed? The minutes stand approved. Now time for our fiscal report. Mr. Reed, if you would.
Thank you, Mr. Chairman. The report you have in front of you is our year-end report for the fiscal year ending June 30, 2013. Just to run you through kind of the basics of this financial report. About 14 months ago, the Board of County Commissioners adopted the Health Department's budget of $9.448 million. That's the column entitled Original Budget. Since the adoption of that budget, we have increased the Health Department's budget by about $245,000. That is primarily, you can see on the line DHHS and DENR, that is federal and state grants. We've increased that by about $156,000. The other large increase is in the column or in the row called Other. We've increased that by about $86,000. That's actually private grants that we've either increased, the funding was either increased or we aligned the budget to the grantors' amounts. So that took our budget up just under $9.7 million for the year. At June 30, we closed the books, and looking back, we brought in $8,954,000. That was without using any of our fund balance. We bumped that against our expenses for the year of $8.9 million, so it's actually, we have a surplus of almost $51,000, $50,830, which we will add back to our fund balance. So instead of having to use part of our $288,000 that we budgeted, we're actually going to increase our fund balance. Just a couple of items to note. Our Medicaid fee revenue was significantly under budget by about $240,000. We've talked about that throughout the year. Part of that reasoning was a decrease in frontline nurses, and we had, not only did we decrease frontline nurses, but we had vacancies throughout the year. I'm happy to say all the nursing positions now are full, so hopefully that element will go away. We did have a positive on our Medicaid cost settlement. The Medicaid cost study came in about $99,000 over budget. That helped to offset the Medicaid shortfall. Clinic fees were under budget by about $45,000. Environmental health fees, just under $5,000 under budget. The DHS and DENR revenue, that is really a reimbursement of expenditures. So the fact that we're under budget $108,000 on that is reflected directly in personnel and operating costs being under budget by the same amount. Again, the county transferred their entire appropriations. That was $4,028,000. And then the other revenue is under budget $152,000. Again, those are private grants that are reimbursements of our expenditures. So the expenditures were down the same amount. So all in all, when we bump it all together, it was not a bad year, better than I had expected. Remember, going into it was a very, very, very tight budget. The fact that I think I was standing up here 4 months ago telling you we'd probably use about $100,000 of fund balance. Finance people are conservative by nature, but think we did pretty good, bringing in 50,000 in. I did want to just show you a second page of that report. I just wanted to roll forward the fund balance for you. And if you look a couple of years ago, July 1st, 2011, going into fiscal year 2012, we had $821,000 in our fund balance. In fiscal year 2012, we actually added $231,550 to fund balance, which took us up to $1,052,000 going into 2013. We had budgeted $288,000, so if we would have used all that going into this next fiscal year, the one that started about 45 days ago, we would have expected to have about $764,000-$65,000 in fund balance. The fact that we didn't use the 288 and actually increased by $50,000, we're taking our fund balance up to $1,103,000 now going into the current fiscal year. If you remember, we budgeted $308,000 of fund balance to support operations in fiscal year 2014. And Mr. Chairman, that is my report. I will be glad to answer any questions or attempt to. Yes, sir.
Over the past year, you've done your best to not to try to cut positions. I know you've had some folks retire and so forth. And you mentioned you have all the nurse positions filled. Do you have any non-nurse positions filled, clerks and so forth that you?
That are vacant?
Yes, sir.
Unfortunately, we do. We have, in my division, we have four vacancies. We have recruited and hired, made offers and been accepted two of those positions. One was an interpreter position and one was in the business office. We still have a vacant business office position that we're trying to fill. And I believe we do have a nursing position in a grant that is vacant in the Nurse Family Partnership. But I believe that's being recruited. And actually, I think we're having somebody come on board here very shortly for that. So we're pretty close to being fully staffed with a few clerical positions.
The position that we just got in environmental health is vacant.
Oh, and the new position that the Board of Commissioners allowed us to add to environmental health, the clerical position, we are currently recruiting for that position.
Okay. But say, the old expression, we'll let money burn a hole in your pocket, but if you got 50,000, could you hire a clerk? And fringe benefits, and it probably wouldn't be 50, I don't know exactly what your pay scale is, might be some of that, and because I know you, like I say, you cut back about as far as you can, not tomorrow in your personnel areas.
Yeah, that's a great thought. We didn't know that we were going to have this 50,000 until last week.
Till last
Is that
week.
right?
Of course, it does commit you for more than
Yeah.
1 year.
Correct.
Yeah, that's right, that's right. And I think it is significant, too, to look at our Medicaid cost study. Although we got more than expected this year, we got significantly less than we did last year.
About half.
So that's trending down.
It is.
It's hard to divine a trend from our Medicaid cost settlement. It really seems to be all over the place. And that's because the way they do the cost study is changing. So it is very hard to predict. Yes. I will, one caveat about the numbers, while they are the final numbers, the auditors, which will start their work in about a month and a half, may have some adjustments. I don't foresee that. We've never had that in the past. And we've looked through it, both myself and the finance people on this side of the river, and it seems to be, pretty much straight up.
Any other questions or comments for the fiscal year 2012-2013 final report? If not, do I have a motion to approve?
So moved.
Second?
Second.
All in favor, say aye.
Aye.
All opposed? That report stand approved.
Thanks, sir.
So moving into old business, we have an item on the agenda for discussion, the smoke-free bar settlement. That'll be me, Mr. Chairman. Thank you. You have in your packets a copy of consent order from July the 12th, 2013, from District Court.
And then this addressed Benjamin Edwards and Lynn Owens, who are owners of Live Bar, and George Beeman, the owner of Club 519 Fifth Street Distillery and Mac Billiards. As you remember, we've been dealing with the decision on the smoke-free bars issue for some time with that. The county attorney has been working with the attorney representing these bar owners, and they reached a settlement last month, as you see there. We were pleased that the owners of Live actually have paid off their fine in whole. That was the amount of $10,000, and they paid that actually, I think, just the week after this consent order. And I just remind the board and the public that all of that money goes to the Pitt County Public Schools. So that check, I think, has been forwarded to Pitt County Public Schools, and I'm sure they can use it. The other, Mr. Beeman, I think, is submitting monthly payments, and that's in the amount of $277 a month for 36 months, with the stipulation that if they do violate the requirements of the law, again, that the original fines of $89,200 for Live and $124,200 for Mr. Beeman would be reinstated and immediately due and payable. So we're pleased that we're able to bring them into compliance. We're not having any other issues with immediately with bars. I issued the first violation last week on one of the bars downtown for not having signs properly posted. But overall, it's going, I think, much better than it was. So we hope that these kinds of actions are behind us, and we've improved the environments for folks that want to enter restaurants and bars in Pitt County.
Thank you. Any questions for Dr. Morrow? Any other old business that anybody has before we move on to new business? If there is none, let's move on to our agenda for new business. Clinic fees update. Mr. Reed.
Thank you. That's me again. I did want to bring to the Board of Health some work we've done on our clinic fees here recently. And just a little bit of a background, we try to base, our goal is to base our fees on the actual cost of providing each individual service. And it's very difficult to, as you can imagine, to compute what the cost of each individual service is in the health department setting. What we have used in the past is the Medicaid cost settlement report, which would give us, using the Medicaid approved format, what each of our services cost. And the last Medicaid cost report for fiscal year 2011, unfortunately, was the last Medicaid cost settlement report where they provided us that information. Again, the Medicaid cost settlement regimen has changed. So our current fees are based on the actual cost of the services as calculated by the 2011 Medicaid cost settlement. What we did was, based on that cost settlement, we came to this board and got your approval to set our fees at 105% of the amount calculated in that Medicaid cost settlement. And the reason we set it at 105% was to maximize future cost settlement amounts. However, since the 2012 Medicaid cost settlement did not provide us that information, we really didn't have a good mechanism to calculate our cost. So what I did was, just to make sure that our costs were in line and reasonable for the area and for health departments, I obtained the Wayne County Health Department fee schedule and also the Beaufort County Health Department fee schedule, and compared the fees that we have in common. And what I found out was 60% of our fees are within plus or minus 25% of Wayne County, and a little bit more than about 70% of our fees are plus or minus 25% of Beaufort County. When I did that, though, I didn't really know what that told me. But my goal was to make sure that our fees are at least equal to or more than the Medicaid reimbursement rate. So when we submit a claim, we will get the maximum Medicaid reimbursement. So I compared our fees to the Medicaid reimbursement rates. 90% of the health department fees meet or exceed the Medicaid rate. Of the fees that don't, about half of them are within pennies of the Medicaid rate, and most of the other fees relate to the cost of the vaccine that we administer to patients. And we set the cost of our vaccines at our cost. So that can be more or less than the Medicaid cost rate. So based on my review, I'm not recommending to this board that we change our fee structure at this point in time, with one caveat is that about the vaccine cost. If our vaccine cost increases, then we will increase the fees for those specific vaccines. And also, when we administer a vaccine, we charge the cost of the vaccine, but there's also a vaccine administration fee that we charge also. So based on what I'm seeing is our fees are pretty much in line with other local health departments in the area, and they meet, or the vast majority meet or exceed, the Medicaid reimbursement rate.
Thank you, Mr. Reed. Any questions?
Yes. Should the cost of your vaccines go up and your labor costs or administrative costs go up, we do have the option of adjusting those up or down as the case may be.
Yes, sir. We do.
And that can be done on a timely basis.
Right, and the reason we obtained that authorization to allow us to be more nimble and to react quicker.
All right. Any other questions for Mr. Reed? Thank you.
Thank you.
We now move on to a communicable disease annual report. And we have with us tonight Ms. Kimberly Hardy, who is nurse practitioner. Welcome.
Thank you. Good evening, Board of Health members and Vice Chair Dr. Hayes. I'll be presenting the report to you tonight. I am a family nurse practitioner. You mentioned my name, Kimberly Hardy, and I'm a clinical supervisor at the Pitt County Public Health Department. I'd like to start tonight's presentation just by reviewing why we actually are doing communicable disease here in Pitt County. As you all know, our work is mandated in the North Carolina General Statutes, Chapter 130A, Article 6. I just want to highlight just a few of the duties that this statute empowers our local health director, Dr. John Morrow, and his staff to execute. We are charged to investigate the cases of infectious, communicable, and other diseases, to exercise quarantine authority and isolation authority. We are charged to enforce the immunization requirements, to examine and investigate cases of venereal disease, to examine and investigate cases of tuberculosis, to examine and investigate and control rabies, and basically keep Pitt County healthy and free of communicable disease. The objectives of our program are the following: control the transmission of communicable diseases with appropriate prevention and treatment, to detect cases of communicable disease in the community, and to monitor the incidence of new communicable disease cases. Our program primarily works with diseases that are reportable according to North Carolina law. There are 70 in the state. Examples of the ones that we spend the majority of our time on include STDs such as gonorrhea, chlamydia, gonorrhea, and so forth, airborne diseases such as tuberculosis, foodborne, salmonella, animal-borne, includes Rocky Mountain spotted fever, West Nile virus, and rabies, blood-borne, hepatitis A, B, and C, and waterborne, amoeba, cholera, and Legionnaire's disease. In addition to the diseases that we investigate or monitor that are reportable, we also deal with diseases that are not reportable but are outbreaks in the community. This includes influenza or the flu, certain healthcare-associated infections, and norovirus. I will next go over the diseases or conditions that actually require most of our time in terms of surveillance, reporting, and planning, and data entry. Hepatitis B and hepatitis C are two that require a lot of time for our communicable disease nurse. I have listed here some of the statistics for hepatitis B, but I won't necessarily get into that. What I would like to tell you about this is that it's a vaccine-preventable disease. Even though our communicable disease programs are segmented in terms of one nurse deals with immunizations, one deals with tuberculosis, another deals with STD, we try to incorporate all of those services into each clinic visit to make it more efficient for our clients when they come in for service. As you can see on the slide, hepatitis B for 2012, we had 9 acute cases, 18 chronic cases that were investigated, and 17 suspect cases that were investigated. For hepatitis C, we had 5 acute and 27 chronic. These numbers may not seem significant, but when you consider the time that it takes for our nurse to make phone calls to our local doctors, to communicate with various state personnel, with the contacts, and with the clients involved, it takes quite a bit of manpower to investigate these cases and suspects. The next disease category that requires a lot of time are foodborne illnesses or foodborne diseases. 1 in 6 people get sick each year from contaminated food. That's about 48 million people. Most often, foodborne diseases are acquired by inadequate washing of fruits and vegetables, lack of good hand washing, or actually hand washing in general, eating undercooked food, and improper food storage. There are 3 diseases that I'm going to just show you that we actually had cases and suspects for this year. The first one is Campylobacter. We had 25 cases and 1 suspect. As you can see, that's actually the highest that we've had in 3 years. Salmonella, we had 28 cases and 2 suspects. And Shigella, or shigellosis, we had 1 case and 1 suspect. All 3 of these diseases cause gastrointestinal illnesses. The next set of diseases that I would like to talk to you about are tick-borne diseases. There are 3: Rocky Mountain spotted fever, Lyme disease, and ehrlichiosis. Rocky Mountain spotted fever, we had a lot of suspects in 2012. There were 70. There were 15 cases. Lyme disease, although we had no cases, there were 20 suspects that had to be investigated. And luckily, for the word that's most difficult to pronounce, there were none. All right, immunization program. The goal of our immunization program is to eliminate vaccine-preventable diseases in North Carolina. The way that we plan to do this is by adequately vaccinating our population, especially in childhood, to make sure that by age 2, every child has received the appropriate number of vaccines. And then the other way that we plan to achieve that, or have worked to achieve that, is to manage outbreaks of vaccine-preventable diseases. Our immunization program objectives are benchmarks from the program, from our state program. At least 89% of all eligible 2-year-old children served by the local health department will have documentation of age-appropriate immunizations in our North Carolina Immunization Registry. Our health department rate is 91%, so we have met that mark. To meet this mark, we really rely on the collaboration that we have with our community partners. Our Pitt County school nurses, our public and private schools, daycares, after-school programs, Pitt County physicians, all of us working together help to increase this rate and help us to keep our community safe. At least 76% of all eligible 2-year-old children residing in the county will have documentation of age-appropriate immunizations in the North Carolina Immunization Registry. We are working to meet this goal. Currently, we are at 72%. And again, there's a lot of collaboration that goes on to help to make sure that occurs. We have several outreach opportunities that we engage in. It varies from year to year. It varies based on staffing and funding and all of those important issues. But we offer immunizations at our annual maternity fair that's held in May. We also offer immunizations and education during our annual immunization campaign that's held in the fall. Through the Pitt County's effort with Project Homeless Connect event, we also offer immunizations and screenings during that event as well. Although 2013 event has been canceled, we hope that that will be slated again for 2014. And we also have evening clinics for back-to-school shots. We do have Healthy People 2020 objectives for future immunization program goals. By the year 2020, we hope to increase the age-appropriate immunization levels of all eligible 2-year-old children served by the health department to 89% or more. We are there, but we must maintain that and actually succeed that rate. By the year 2020, assure that at least 95% of North Carolina children aged 0 to 18 are represented in the North Carolina Immunization Registry. And by the year 2020, increase the age-appropriate immunization levels of all eligible 2-year-old children residing in Pitt County to 71% or more. And we did meet that goal in 2012. Our next program is the STD program. Our objectives of this program is to monitor the STD rates and trends in Pitt County, to ensure adequate treatment is given to all patients that are seen in Pitt County by both private and public medical providers, and to report to the state's Communicable Disease Branch and eventually the CDC using the NCEDS system in a timely fashion. This first slide that I presented for you is just to kind of give you an overview of all of the positive STD tests that we received for 2012 for Pitt County residents. The most prevalent disease, or the most popular, or you get just what I'm saying, the most popular disease of the ones that came back positive. Chlamydia was 73%, while gonorrhea was 16% and NGU was 11%. And these are bacterial diseases. To give you a feel for how we compare in the state, this slide to me speaks volumes for why we are actually doing what we do. Our chlamydia rate exceeds the state by double, at least double. Our gonorrhea rate is in the same trend, and our syphilis rate is not too far away from our state rate, but all of these rates are too high. Our Pitt County chlamydia incidence, as you can see, we've had an upward trend. This year we kind of came down a little bit, but still these numbers are too high for our population. Chlamydia incidence by race. The next few slides will just show some of the health disparities that exist within racial, gender, and age in terms of incidence of STD events. 69% of the chlamydia rate is in the African American population. 22% is Caucasian. And there's about 8% that our data we didn't collect. We're not able to ascertain what their race was. Pitt County's gonorrhea incidence. There's a little bit of a downward trend depicted in this graph, but again, the numbers are still significant. They're too high. 2012 gonorrhea incidence by race, again, health disparity, there's 69% in the African American community. 2012 NGU incidence by race, again, same trends. Gender. This slide may represent a multifactorial composition of why the trend looks this way. Most of us think it's because we see more females in our clinic than we do males, but our female population attributes for most of the STD diseases that are diagnosed in Pitt County. 2012 incidence rate for age. This slide just depicts that our age group from 15 to 24 has the highest incidence of bacterial infection. HIV. Our HIV numbers, as you can see, have increased as well. 2009, we had a higher number calculated there in 2011. And I want to point out on the next few slides that for 2012, you will see a dip, but that's not a real dip. It is a dip that reflects a collection of data from January to June of 2012. We will have the residual numbers for reporting for our next report in 2013. The reason for this change in reporting is because on April 1st, 2013, our current data system was STD-MIS that we used here in Pitt County to capture these numbers. We transitioned over into NCEDS this year, and so we are actually entering that data, and so there's a backlog of data entry for these numbers. So these numbers, don't get excited that they're low. They're really not. AIDS incidents, 17 for January to June for 2012. And you can see the trend for syphilis. This is probably going to be the most concerning slide when you see it again in 2014. Our syphilis rates for Pitt County are astronomical. And you can see for January to June for a 6-month span, if you were to just guess that it would double by the end of 2012, you'd see that we'd have 36 versus the trending of 27 the last 2 years. On to our TB program. Our TB program goal is to eliminate tuberculosis disease as a public health threat. We will do this by reducing the number of new TB cases and controlling the spread of TB in the general population. Since 1980, the number of new cases has declined by almost 5% per year in North Carolina. TB incidence in North Carolina has decreased 21% between 2006 and 2010, which is very good. So we've gone down from 374 cases to 296. Most of that decline is attributable to the resources that have been used to strengthen the TB program in North Carolina. In Pitt County last year, we had 55 cases of latent TB infection. As you can see, again, we did a demographic breakdown of the incidence of disease. 65% was in African American population, 22% Caucasian, and 13% Latino. 2012 TB infection caseload, this is actual TB cases, was 5. And you can see the breakdown here. So in summary, our CD program, it's very important that we communicate with our community partners to make this effort successful. We rely on local, state, and federal public health agencies, private physicians, hospitals, schools, occupational health, occupational infection control. In all of these efforts, we want to stress that all patient information is kept confidential. We would like to thank you for your time, for listening to our report. I would like to take just a moment to highlight the staff members who work and manage these programs on a day-to-day basis. Lee Draper is our immunization coordinator. Cindy Kilbrew is our CD program coordinator. Renee Williams, STD, and Connie Yarnell, TB. Any questions?
Yes, ma'am.
Yes.
Do you have any data concerning the Rocky Mount cases, whether they were attributed to all, as for lack of a better term, local ticks here, or did some of these people venture outside of Pitt County, possibly bringing exposure in with them?
That's a good question, and I do not have that data tonight for you. We can get that for you.
I'd be interested.
I'd say
As
it's
far as-
both, DH.
Pardon?
I think it's both. We've got folks that, that live here and vacation or go to other places in the state and become exposed and then come back and get diagnosed here.
As far as your immunization requirements, do those regulations transport to private church as well as state and federal supported institutions where the children may go to daycare or institutions of that nature?
That's a great question. They are basically universal. They are guidelines across the country.
So all the parents, when they sign up for an institution, or to your knowledge, they provided with this information that before their child can be enrolled, that by a certain deadline, they have to present compliance?
Yes, it is state law that all children who enter kindergarten must have a primary series completed.
Kindergarten.
Daycares are also in the same, any public where they're actually gathering with other children, they are required to have those immunization requirements met before they're allowed to enter, or they have 30 days after enrollment to get up to date.
After enrollment. But enrollment may not correspond with the date of actual start of the program.
From 30 days of entering into their setting, daycare, school, they have 30 days to get those immunizations up to date. Does
So
that-
basically, someone could enroll the day before, and they could be attending for 29 days
could.
before they would have to comply.
They could. Yes, they have time to catch up, because there's a series, there's an interval, minimal interval of 4 weeks for most immunizations to be able to actually do a catch-up regimen, which is different from the standard immunization.
So
Schedule.
Pitt County does provide some type of educational flyers, information on the TV network or to the different institutions to help them understand, to prospective clients that may be attending.
Pitt County may not do that specifically, but with each program, let's say kindergarten and childcare centers, they are monitored by their own governing institution, like the North Carolina Division of Child Development, and the childcare center has to be in compliance. They know in order to enroll a child, they have to have a certain number of immunizations completed for each vaccine type, whether it's DTaP, Hib, polio.
So a facility could lose their license to do business, did not.
They could lose a star, and they could lose their stars. They speak more in stars. They may not be shut down, but they could lose their stars.
Well, the stars have to do with the
The quality.
Smart Start quality. So we have childcare health consultants, a nurse, and a health educator in our department who work with daycare centers in Pitt County. They also have them in Martin County as part of Martin Pitt Partnership for Children, which is a Smart Start agency here. So we have those childcare health consultants work with our daycare centers in Pitt County to make sure that all those children are properly vaccinated. I think your question about whether a child could come into a daycare center and actually be there unvaccinated for a period of time, the private daycare centers have the option of not allowing them in. And I would say that most of them would do that, not allow an unvaccinated child into their daycare center. Some of the church daycares do not have to meet the requirements because they don't have as many children, or they don't have them for as long a day that the licensed
Exceptions.
childcare centers have to meet. Children in the schools, if they get to kindergarten, they are allowed to stay in for 30 days, but most of those children have been vaccinated, at least partially. The law requires them to be properly vaccinated at all ages. So even it used to be, we said that children didn't have to be vaccinated till they got to school. That law changed years ago to where a child that's 6 months old legally has to be properly, appropriately vaccinated for a 6-month-old child. So unless that child is coming in from another state, and other states have also gotten better at this yet, and the immunization registries are helping information to be conveyed from state to state about immunizations on these children. So it's pretty unlikely that a child would get into our schools that hasn't at least been mostly vaccinated, if not completely.
Is there any program that's existing that could be put on the public network to discuss this, or is there a project or something out there that could be an adjunct as far as a public information series to discuss this? I mean, we're getting into a timely period where this information is probably critical knowledge for a lot of people.
Right, and we work with the public schools to get that information to parents who are bringing their children into the school. We've done that for quite a long period. But could there be more done? Absolutely. And yeah, I think, we used to have funding that allowed us to have a nurse coordinator who made sure that children who were behind on vaccinations, we tracked them down and talked to their parents and got them properly vaccinated. We lost the funding for that a few years ago, so we were not able to do those kinds of things that we used to do in immunizations, and I think you saw our rates. They're not bad, but they could be better. 71% in the county, that's in the immunization registry, and part of that is some of the private docs still aren't are not working in the immunization registry. Some of the pharmacies will be doing, I think, more vaccinations. They just passed along the General Assembly this year that will allow, not with children, but with adults, they'll be doing more of those adult immunizations. But yes, we can do a lot more, I think, in terms of improving the percentages of, we ought to have 100% vaccinated all the time, I think. So the only reason, that people aren't vaccinated legally is because of either a religious exemption or a medical exemption because they're allergic to the vaccine typically.
Dr. Johnson?
What about homeschooled children?
They're still required to be vaccinated.
Well, I understand the requirement, but how can you implement the requirement with the homeschool?
Well, that is a difficult one. So unless they enter a system somewhere where it's required or looked at, we may not even know they're out there and not vaccinated. So we hope that we will be able to tie the immunization registry in with the birth registry so that when children are born, they're often getting their first hepatitis B vaccine at birth now. That data goes into the immunization registry, and we'll be able to track those children along to know if that child hasn't had their DPT vaccine by 3 months of age, then we should be finding out where they are and why the parent hasn't gotten them protected. Pertussis has been a serious issue in the United States here recently. So children, particularly younger than 6 months of age, are at risk of serious infection and even death from things like pertussis still today. So we're getting there in terms of having better tracking systems, but we've still got a long ways to go.
Are we, hypothetically here, are we doing a better job immunizing pets than we are humans?
I think that's pretty doubtful. I mean, the vaccination rate for animals is pretty good amongst a certain segment of the population from what we see, but there are a lot of animals that are not vaccinated, and we have vaccine clinics pretty regularly, as mandated by the state, and we see a lot of folks come out for those vaccination clinics that probably otherwise would not get their pets vaccinated. So it is, I don't think that the numbers are known. They're not even, we have no clue, but I don't think they're better than what they are for the human population.
Thank you.
Mr. Bronson?
Yes, I have a question. You have mentioned the STDs. What Pitt County ranks in the state when it comes to numbers?
I would have to tell you that I did not gather that information for you, but I can get it to you after this meeting.
Well, now the other question that I have is, it seems like that the large percentage of this population is African Americans. Do you have the age, what the age ranks in this population here in Pitt County?
That data is published, but I did not have it for this report. You want to know African-American,
African-American,
male
the
age group,
yes.
female age group. That data is available, but we did not, for the time period that we have for this meeting, I did not bring that information.
I think if you look at the state map.
Populations.
Yeah, most of the cases are in the densely populated areas. Charlotte, Mecklenburg has the highest rates. Guilford, Greensboro area, Raleigh. If you look down east, we've got more than the western part of the state. This is in general with sexually transmitted diseases. And Pitt County has more than many of the surrounding counties in eastern North Carolina. So our HIV rates, which are increasing, along with syphilis rates are going up right now, she mentioned. Chlamydia is way above what the state has. And I think it's important for people to remember, too, North Carolina does not rank well compared to the rest of the country with sexually transmitted diseases. The Southeast typically has been
Now,
very
does,
high
does the
compared to other
state
states.
or the county has any plan or program in place to kind of reduce those numbers down? Education outreach, so forth.
Well, prevention is key. So, in public health, we do a lot of education regarding preventive measures to help decrease those numbers. Globally, or let's say in the media, funding is a big issue with that. So I'm not aware of any efforts that we have underway at this time in terms of throughout the entire population media-wise. We have several, we have an outreach effort with one of our health educators who goes and does education with our, in various high schools in terms of delaying and preventing premature sexual activity. And Picasso and their other efforts within the HIV with our disease intervention specialist, Kent Ainge and Diane Scrivener. But in terms of media-wise, I think that our resources are a little bit limiting with what could be done to help impact those rates.
Dr. Ramsey?
Enjoyed the presentation, and we've been watching these rates now for a couple of years. And if you look back at the minutes of of our meetings, we've discussed this several times. We're double the state rate with chlamydia and gonorrhea.
Yes.
I would think we'd like to see some sort of a concrete plan about how to approach this problem. We have had one meeting in the past year with the emergency room physicians, some of their leadership at Vidant Medical Center, because they represent the detection of at least a percentage of your pygraphs. And we discussed with them how to perhaps do a better job. They're doing a good job of diagnosing, but it's a challenge to capture those patients and treat them successfully once they've left the emergency department. I don't know what kind of impact we've had, frankly, since our last meeting, but I would like to see some sort of concrete approach to see how we're going to approach this and actually achieve success. I would estimate if you look at the CDC's MMWRs, there are at times reports of communities who have been successful at decreasing sexually transmitted diseases. Plus, I'm sure you have colleagues elsewhere that could also offer advice in this area. But I think we've watched and we've surveyed enough. Now we need to see some positive action taken.
I think you are right, and I think we share the same sentiment. I think it falls down to resources and having the ability to have funding to make that happen.
I think the Pixie grant was
Yes.
along those lines, really, and we saw some decrease last year
We did.
in these rates, which made us wonder if it was in relation to Pixie. Part of what we did with that Pixie grant was to do an express clinic for people who could come in and get a very shortened service. And because of some of the restructuring that we survived through the last year, we weren't able to keep that up, but we are in communication right now with the CDC. Are they coming next week? Or this Thursday? They're coming this week about re-implementing that. And so those are the kinds of things I think that we can do inside the health department. Getting out into the community and implementing those programs really takes a lot more effort in some of those things we have done in the past, but those are much more involved and typically require a lot more resources too, which we haven't had recently. But I agree that we need a strategy to address this problem, much like we've talked about with infant mortality for a long time here. And one of my issues tonight during my report was that I think we've got to get back on strategic planning, which I think we'll talk about more next month at our meeting next month.
No.
Does the Bernstein Center help us with this regard?
Sure. The Bernstein Center is a primary care provider, so they're seeing patients who may have communicable diseases, so they're reporting just like any other private physicians in the community, and doing some treatments of STDs and other communicable diseases also. So I think they're doing what they can. The Bernstein Center has been very short on providers. They just lost, I think, another nurse practitioner this month. I was talking with Dr. Tom Irons today, who works closely with them, and so they've had a shortage of providers and are stretched in terms of resources as well right now.
But they do know that what they're doing is helpful for the county.
Oh, absolutely.
When do we reach threshold that we declare this as epidemic?
You get into the definition of an epidemic. It is an epidemic. It's way outside the normal expected rates. I guess the problem is that we've had these abnormal rates for such a long time that it's a chronic epidemic. And when you look at some of these rates, for instance, syphilis, I guess 20 years ago, looking back at Deborah Herring, who was here 20 years ago, she can probably tell you how bad syphilis was in Pitt County back then. It's not near that bad today, so it has improved, but still compared to other places in North Carolina, United States, it's much higher than it should be, and so we do need to address it.
But politically speaking, it doesn't happen in Mecklenburg County, is that right?
I'm not sure I followed you. It's happening a lot in Mecklenburg County right
Yeah,
now.
but I mean, they pretend as though it's not happening.
Well, they've got so many more people.
Percentage-wise.
Right.
If I could offer the, one group of leaders in the African-American community are the reverends and pastors. And many churches will have health fairs and different activities going on, particularly on the weekends. Have we partnered with that group? I know I did some of that in Alabama with HIV prevention. We partnered effectively with that group to make sure that we have representation there, or booths, or the opportunity to, because many folks show up on Saturday, they also come on Sunday to church, so plus families tend to come to those health fairs and different activities. Vacation Bible School, I know I spoke a number of times to Vacation Bible Schools in the evenings when you had everybody there to talk about HIV prevention.
You bring
Very,
up an
very well received by those.
You bring up an excellent point, and I think all of us know the issue with this particular disease process is multifactorial. I think it's a wonderful idea to partner with the faith community. There is a barrier with that, though, that we have done some initiatives in the past. I personally have done some initiatives in the past. But when you begin to talk about things like this, it's not necessarily a Sunday morning topic. It is difficult to get to the behaviors that cause some of these issues. In the faith community, we've gotten away from some of the traditional education that we've been giving our young people about don't. We say instead, use this. So our approach to this from an at-home standpoint has changed over the years. And I think some of what we see now is that's part of the problem. The other part is the media, and peer pressure and different issues. But I think you bring up a valid intervention, and it's one that we have done on a, not so much a global scale. When I say global, I mean, you know, you've got 10 churches targeted, and you're going to every church and presenting this information. We can look at that. We can look at that. There are lay people within the churches who could partner with us to help provide this information to their young people and to their congregants. That's a good idea.
Any other questions?
I was wondering, how does the university impact the very high incident age group of 15 to 24-year-olds? Are their numbers included in these data?
Yes, that's Pitt County. That's all the residents here in Pitt County. While they're in college, they're considered to be a resident in this county for data purposes.
Or
So that
reaching
does
out to the
include
university
them.
as well and doing any kind of...
I have to go back to that resource thing. We are able to take care of our clients in the clinic in terms of being able to reach out and work with them. We work with them through the Pixie project Dr. Mara mentioned, and that they assist with helping us with data collection for that and testing their patients. But I believe that is the extent of what we're able to do at this time. Dr. Mara, do
Well,
you
we
have
see a
anything?
lot of those students from East Carolina actually are seen at our health department, particularly for sexually transmitted diseases. They sometimes will go to the infirmary or the school health center, but oftentimes they'll want to come see us. But yes, we do work with them. We've, I've gone over to the student health center multiple times and done educational type things. And
Just
we
what I
partner with them with the Pixie Project to do some of those things. So
Sure. I just
We're
thought
trying.
with the numbers being so high in that age group, if that really had a significant impact.
Yeah. Yeah, absolutely. And we do, folks like Picasso, the Pitt County AIDS Service Organization, have done a lot of things with the university also in terms of HIV prevention. And
So you are the front person if we had an idea to contact.
Maybe.
Sure.
Just a little humor. Yes, sir. Thank you.
Thank you, Ms. Hardy, for your report. And, we appreciate the work that the Communicable Disease Program does to make us aware of the issues, even if we don't immediately have solutions for all of these issues. I think that concludes new business, and we'll move on to the Health Director's report.
Okay, thank you, Dr. Hayes. Just want to mention a few things. As the financial report indicated, we did do much better this year than we expected to do, actually adding to our fund balance. And I think, as Mr. Reed mentioned, this was due to our conservative budgeting and a lot of hard work by our staff to be frugal and make our public funds go as far as possible. Grant funds have also helped relieve some of the fiscal responsibility for the county budget. We were notified just last month that our application for a federal HRSA grant was approved but not funded. That was for about $500,000 a year. And the message that we got, I think, was that it was not funded because of sequestration, the federal cutback. They had planned to fund 39 projects, but only ended up funding 12, as we understand it. So we do plan to resubmit this grant this fall, though, if possible. East Carolina University is including our health department in a grant submission to the Center for Medicaid and Medicare. Actually, this week, it's going in, I think, Thursday. And that was specifically help us address infant mortality in Pitt County. Enrollment for the Health Benefit Exchange or Marketplace is scheduled to begin October the 1st. And navigators and certified application counselors or CACs are supposed to help people get enrolled. Counties are trying to prepare to help with this effort so that more people will have some form of health insurance. There's a lot going on right now. I was in a meeting in Raleigh today where this was again discussed. There there's a lot of confusion, but there's a lot of excitement also in terms of what the potential is for getting folks enrolled. Presently, the health department has many patients without health insurance, and we have to write off a significant amount of bad debt, as you know, each year. We're hopeful that this push to ensure more people will improve our finances and help people in the county also to become healthier. We're going to be working closely with physicians, clinics, and our hospital to make the enrollment process happen as smoothly as possible. There is a lot of angst, I know, right now about the Affordable Care Act and how it will be implemented. I think it's really important for those who are old enough to remember 1965 when Medicare and Medicaid were created, that there was, I think, a similar nervousness about how this was going to take place at that time. I think it's important for people to remember why we need to change in our healthcare system here in the United States. The U.S. currently spends more than twice as much as per capita on healthcare than the next highest nation in the world, and yet our health status is worse than some second and third world countries, with our life expectancy actually decreasing. Our children may actually live shorter lives than we have. More than half of American adults have a chronic disease today that should have been and could have been prevented had they had care. We have to change what we do and how we are doing it, and we have to invest more in prevention and specifically invest in public health. Just to update you on some of the activity in the state, our state health director, Dr. Laura Gerald, resigned about 2 weeks ago, citing differences with the Department of Health and Human Services Administration. Secretary Vosh immediately appointed Dr. Cummings as the interim state health director. Both Dr. Vosh and Dr. Cummings will be attending our North Carolina Association of Local Health Director meeting in Raleigh this week, and we hope to learn more details on what they have planned for the future direction of the Department of Health and Human Services, the State Division of Public Health, and how those changes might affect local departments like ours. The Health Directors Association has been doing strategic planning for approximately 2 years, and we'll be releasing a plan for from the Public Health Task Force as soon as it has been approved, and that should be very soon, within the next couple of weeks. Also, just wanted to let y'all know that we're celebrating World Breastfeeding Month this month and there's an event this Saturday, August the 16th, at the Pitt County Agricultural Extension Building in the Pitt County Office Park. That's from 10 o'clock until noon this Saturday. And this is sponsored by the Pitt Infant Mortality Prevention Advisory Council. As we mentioned earlier, our staffing, we've hired some new staff recently and have also lost some staff. And most notably, I wanted to recognize the retirement of Miss Jo Morgan, who headed up our health education division here and was with the health department for more than 30 years. She retired last month, and we will greatly miss her. We have just gotten permission today from the county manager to advertise for this position, so we hope that we will be able to recruit that'll be a master's level health educator, and hopefully we'll be able to fill that hole soon. And last but not least, I received a report last week from our animal control folks here in the county that we had a raccoon that was positive for rabies. So back to your point, Dr. Johnson, please get your pets and animals vaccinated properly.
Thank you, Dr. Morrow.
Mr. Chairman, I appreciate the fact that Dr. Morrow used the proper terminology, Affordable Care Act. It is not what a lot of people like to refer to, and I will not mention it because I do not want to promote anything other than Affordable Care Act.
Very good. I have a note here that says we need a motion to accept the communicable disease annual report for accreditation purposes. Do I have a motion?
So moved.
Do I have a second? All in favor, say aye. All opposed? the report is accepted and approved. Thank you. If there is no further business, then I would ask for a motion to adjourn. Second?
Second.
All in favor?
Aye.
Thank you very much, and this concludes our meeting for this month.